as a geriatrician at Northwestern Medicine, I see so many older adults taking medicines that they may not need, but they've been taking it for so long. And what happens with polypharmacy is that we don't even think about it as providers. We keep on adding medicines. So make sure your seniors see their primary care doc, and then go through the med list and make sure that every single one has a reason, and not just I've been on it for 20 years. Think about stopping those medicines before they start any medicine. Is there a medicine that's actually causing the problem? And should we be taking those off? Because there's been so many studies out there where a calcium channel blocker like nifedipine will cause leg swelling. So then physicians will add on Lasix, which is a diuretic, and then the person's on 2 medicines when they should have been on 0. So many older adults are getting started on benzos, especially for sleep. These are your medicines like Valium, Restoril. These medicines are terrible for older adults because we know it works against their balance, and they fall a lot and they fracture their hips. So people are starting it for sleep, but actually causing and making people feel worse and having problems with falls and fractures. I even had a patient the other day that she wanted a medicine to make sure that she went to church. And I said, there's not a medicine out there for that. So what I tell people is think about looking at non-medicine ways of helping people. So for sleep, instead of throwing a benzo at them, instead order them physical therapy, have them do more activity so that they're not napping during the day and that they'll sleep better at night without any medicines. So deprescribing is awesome. It is one of my favorite things to do. And usually it makes patients and families very happy because it's one less pill we have to give a person. But there are still some patients and family members and even providers that are like, whoa, I don't know if I should be stopping a medicine on a 95-year-old. And the thing is that these are patients just like a 40-year-old. And if they should not be on a medicine, they should not be on a medicine. So what I usually tell people is that either your benefit from this medicine has disappeared because you've outgrown it and you're in your 90s and your hundreds and you've already gotten the benefit and it's okay to stop it. And also telling people, let's take a risk. Let's try taking the medicine off. If they're still doing fine, then great. If not, we can always add it back. I see deprescribing as a huge problem when it comes to especially pain medicines, because people just keep on adding on pain medicines thinking, oh, well, they're still in pain, I'll throw another one on. And instead, you have these patients that are on like 6 or 7 different pain medicines and still in pain. So if you're going to throw another pain medicine on, think about taking one off that works. We do know that the gabapentinoids, which is like your gabapentin, your Lyrica, those actually have a little bit of a higher risk for older adults as far as worsening hospitalization risks, worsening problems with COPD, exacerbations. So some of these medicines, definitely think about taking them off instead of adding on more pain medicines. The other thing to think about is the number of pills your older adults are taking, and to even ask them, how do you take your pills in a day? Because even though the bottle says 3 times a day, some of my patients are taking medications at 5 or 6 different times a day, because there's some medicines that say before breakfast, before lunch, after lunch, nighttime, and it's hard for seniors to kind of organize when they need to take it. So it's very simple to say, how do you take your medicines? Is it once a day? You can take them all at the same time. If it's twice a day, you can take them all at the same time, twice a day. But it's useful to help them get things organized so it's easier.